everybody. This is the Thurston County Board of Health meeting on May 13th, 2025. It is 3:48, and happy late Mother's Day to all the mothers out there. And so first order of agenda is to approve our agenda for today. Do I have a motion for that?
We approve the agenda.
All right, so first motion from Heidi Knadel, and is there a second?
Second.
And Perla Newton seconds, and all in favor?
Aye.
Any opposed? All right, we will move forward with the second item on our agenda, which is approval of the minutes for our last meeting, April 8th, 2025. Is there a motion to approve that?
I move to approve the.
All right, Tanzania Gonzalez Marshall. And is there a second?
Second.
And second from Commissioner Grant. All in favor of approving our last minutes?
Aye.
Any opposed?
I'll abstain.
All right, we've got an abstention from Commissioner Mejia. So it sounds like that was all approved. So the next order on our agenda is to do our first proclamation. And do you want to do the introduction?
Sure, I will call up Brian Windrow from the director from Senior Services for South Sound to talk about the National Senior Health and Fitness Day proclamation.
Thank you, Dr. Fry. It's good to see you all again. You're well, and I always appreciate an opportunity to come before you and speak on behalf of the seniors in our community. I think we all agree that we care about people from before they're born and after our last breath, the whole cycle of human life. And my organization serves all of us when we are essentially 60 or over, is generally the age criteria we use. Thurston County is, without any hubris, fortunate to have Senior Services for South Sound. We are the largest, most diverse and senior serving organization in the state outside of King County. And we do so many things to help seniors thrive. I would like to remind you all that our mission is to improve the quality of life for people as we age. And that means that we do not only help seniors who may be struggling, though we do, it's for every one of us to have a better quality of life. Our trips and tours program, our yoga classes, our Tai Chi classes, academic classes on Middle Eastern history, and on down the list, attract people of every possible type. And we help seniors who are struggling as well. Meals on Wheels, our Brighter Days program that my own family participates in, that helps seniors with cognitive illness and a stage of their life when they are able to not need full-time care. So we were founded in 1973 as a 501c3 nonprofit here in the county. Interesting story. And are still here today thanks to the generosity of people in the community and the caring of this community. So I can't be here and not thank you again for the proclamation around isolation and loneliness, which, although you may not hear about it on a day-to-day basis, the work is ongoing, absolutely. I work with your staff and other community partners in the nonprofit community, and we meet regularly and talk about what we're doing on isolation and loneliness. We know that issue is as important to senior well-being as well as well-being of young people as anything physical, right? Because they're interconnected. So thank you for making this proclamation today. We know that we care enormously about all ages of people in our community. And we are here as an organization to partner with you in any capacity to and make sure that seniors are thriving in our community, which is all of us, if we're lucky, eventually, if not already. So any questions you may have, I'm happy to answer. I apologize. I brought annual reports that I've put, but I only brought 10, and there's more of you than that, and I didn't do the math of how many of you there were. So if you didn't get one, I certainly can get them to Jen and get them out to you.
Thank you, Brian. Can you talk about the kind of services that you offer for seniors in our community?
Happy to. So as I mentioned, there are so many different things that we do. So let me start with this. We serve meals. We serve what we call congregate meals those are hot meals for lunch. And we do that all over Thurston County. You may be not aware of this, but we do it not only in our Lacey Senior Center just down the road, which, by the way, we're serving over 100 meals a day there. But our Olympia Senior Center, also about 100 meals a day. You may not know that we do that in Rochester and in Tenino. And so we try to reach South County as well. And we also do it in Shelton in Mason County. So we do Meals on Wheels. And that is a program you are no doubt familiar with. What you may not recall is that it is not a program to provide meals to people who are economically disadvantaged necessarily. The only criteria for Meals on Wheels, which applies to any one of us potentially in the future, is that you're really unable to cook for yourself for whatever reason. So people of age eligibility end up on Meals on Wheels because of surgery, which any one of us could have at some point in our lives, which may keep you from getting to the store or standing up at the stove and cooking your meals and so on. And so Meals on Wheels at any one time has about 400 people participating in that program. Volunteers deliver those meals. By the way, everyone wants to be a Meals on Wheels volunteer. Everyone. You probably do. Sorry, we're full. People that get in stay Meals on Wheels volunteers for decades. I mean, like, it's a passionate thing if you can deliver meals to seniors. And we always say that they deliver more than meals because we bring a week's worth of meals to people, and it's often the only human contact that person gets, right? Almost by definition, if you're getting Meals on Wheels, you're living alone. Not always, but almost always. And so the only human contact would be the volunteer showing up to say, "Hi, Jen, good to see you. How are you doing these days?" And when we have that interaction, the volunteers are well trained and they know to watch for changes in the well-being of that senior, right? I'm sorry, I could go on and on, but so Meals on Wheels. Besides that, we have a transportation program that transports seniors to medical appointments if they're not otherwise eligible for dial-a-lift and things that might also be of service to them. They live too far from a bus station or outside the dial-a-lift service area. So we have volunteers that drive them to medical appointments here, but also, and this is important, to specialized care in Seattle, which we cannot get here locally. Advanced cancer treatments, for example, is something we don't have available here in our county. So at any one time, there are hundreds of trips happening for seniors locally who are not able to drive themselves, because that's us eventually, and who are not eligible for dial-a-lift for whatever reason. It doesn't go where they need to go or meet their needs. So food, transportation, activities classes I mentioned, all sorts of activities. The lobbies are open every day. People come in. Everybody's welcome in our lobbies. We feel very strongly about that. And people come in to get coffee, free coffee. It's now free at all of our locations, by the way. Not the best coffee if you're a snob about your coffee. But don't be a snob about your coffee. It's good coffee. And play games and hang out. We have a home share program that we're very proud of. And it is a unique program that we believe provides a very important way for people to avoid homelessness in our community, keeping seniors in their houses, because it's usually seniors who own the houses. And then they get a vetted housemate with them to live with them. It's home share. In a very cost-effective way, both for the people. It's the lowest rent in the county because rent average is about $500 a month. You can't get an apartment for that. And cost-effective in terms of what it costs to do the placements. So home share. And honestly, I could go on and on. We just have so many things. A trips and tours program, and we're a diverse organization. I have about 50 staff, about 33 FTE. Sense of scale for us. Profit loss budget of about $3.6 million this year, to give you a sense of scale of that. About half of our funding comes from contractual funding through the Older Americans Act federal funding that comes out to the states. Some of you know about this. Goes to the LMT AAA, the Lewis Mason Thurston Area Agency on Aging, and they distribute the funding out to organizations like us in Thurston County, and then our partners in Lewis County also get funding from them. They partially fund nutrition programs, transportation, and brighter days. And otherwise, we rely on private donations for about half of our funding. It's about 50-50, roughly. I don't want to go on too long, but
You play banjo, can you get like an extra, like, can volunteer, priority in being a volunteer? Are you adding a service for the seniors?
are you asking if I play
I'm
banjo?
just kidding. I
No,
play banjo.
here's a
You
fun
said it
story.
was, you couldn't be a volunteer, but I'm
For
saying,
Meals on Wheels.
I have value added. So-
I'm sure you do, Todd. I'm sure you do. Here's a fun, really important story, actually. So Mother's Day was just happened, right? And so it was on Monday, we had our Mother's Day meal. And at the Olympia Senior Center, we have a ukulele class, which the instructor for it is a gentleman named Alan Moat, if you know Alan. He's a fantastic gentleman. And he has started this ukulele class from nothing, and now it's prospering. And so if you walked into the Olympia Senior Center that day, you would have heard the ukulele people, which there were, more than you all. Like there were probably 20 of them, 2 rows of people, all playing ukulele, serenading the seniors there who were eating lunch, right? And the moms especially, because it was Mother's Day. So we have a lot of volunteers who play musical instruments. And we have over 400 active volunteers at any one time. So we say that we're staff-led, because we have staff, but volunteer-driven. And if you try to monetize our volunteers across the organization, it's over $1.5 million of payroll a year that we don't pay because we use volunteers so much. And part of our mission is to use volunteers. Like we actually think of ways to use volunteers because as a senior, one of the most important things you can do is still to find purpose in your life, right? Especially when you stop working, sometimes people can struggle with, well, what am I doing? I don't want to watch television all day. And so volunteer opportunities is an important way for seniors to stay active in the community. And we use them across our organization, as you'd expect, to do so many things of all different kinds. We have a SHIBA program, by the way. I didn't mention this because I'd gone too long. The State Health Insurance Benefits Association, it's a statewide Office of Insurance Commissioner program that is a Medicare explainer for seniors. You need to all know about this if you're not already with Medicare because you, I'm sure, like me, don't know much about it. When I become age eligible, I will be signing up for one of these volunteers with SHIBA, and they, in a non-sales way, right, we're not selling anything, they walk people like me through how Medicare works, what the options are, what the law says about it. It's a fantastic program. Just to be a volunteer with that is about 6 months of training. It's highly technical, right? And people like you and I can benefit from that because otherwise, where would you go? Otherwise, everyone's trying to sell you something and, it's hard to trust someone who's trying to sell you something when it comes to healthcare. So the SHIBA program, tell your friends and family that if they become age eligible for Medicare, or even before, a year or two before, if you're still getting curious about it, that we have that program.
Cool. Fantastic. Any other questions?
Just one more shout out, if you don't mind.
Yeah.
My mother passed away recently. We spent yesterday celebrating her life. She had so much fun at the senior, programs that you do, going places. She went to the Mariners games with you guys on the regular, and I just appreciate that so much. I also had a family member a long time ago, 30 years ago-ish, who was in the Service to At-Risk Seniors program, STARS. She was living with my family, and I had little kids and a lot going on, and that program saved us. And so I just want to say thank you. And I was curious if the Brighter Days program is similar to STARS?
It is the same program. We just renamed it about 6 years ago.
Thank you.
Yes, that program in particular, we call it a respite program because the people in it have one of the various forms of cognitive illness, and that's important for them. But the people, as you say, Heidi, same thing for my family now, the caregivers need a break because people get to a point where, you can't leave them alone, for various reasons. And so that means you can't leave them alone, which means, do you take a shower? If you can't trust them around the stove or walking out the front door or, things, right? It's really hard. And so Brighter Days is a program that fits a particular period of time when people are suffering from illness enough that it's a burden to take care of them. It's hard. But before they need full-time care, institutional care. And it is highly stimulating. Music, it's a beautiful thing. Really, if you have it, you won't do this probably, but if you could, just show up at Brighter Days. Say you're going to come, tell us, but show up. Because you walk in the door and there'll be about 12, 13 people there who are singing songs. The musicians come and play and do music with them, playing games of all types. We feed them lunch, of course, every day. It's a really wonderful program that my own mother-in-law is in right now. So it is meaningful to me that I would be responsible for an organization that my own beloved mother-in-law would participate in. You know, that's meaningful to me.
Great.
Yeah.
Well, thank you so much. So we will read the proclamation and then we will go take the photo. So are you okay, Lynn, starting at your end? Do you have enough time to find the proclamation? Page 6.
Thank you.
Yep.
National Senior Health and Fitness Day, is that the one we're on?
Yep.
Okay, whereas May 28th, 2025 is recognized as National Senior Health and Fitness Day, celebrating the many benefits fitness and wellness has on seniors and promoting the importance of regular physical activity to improve the health of older adults in our community. And
Whereas Washington State has the 4th highest life expectancy at age 65 when compared to the rest of the United States. In 2023, Washington State's population of adults over the age of 60 was estimated at 1.8 million, or 23% of the state's total population. According to the United States Census Bureau, in 2023, Thurston County's population of seniors age 65 and older is 19.3%. And
whereas annually on the last Wednesday of May, appropriately 100,000 seniors participate in activities across the United States celebrating the role of fitness in one's health. And
whereas exercise can take many forms and can be tailored for all abilities. These activities can include swimming, dancing, walking, and other low-impact activities. And
whereas benefits of engaging in activities include reduced risk of falls, reduced or controlled blood pressure, increased ability to live independently, decreased anxiety and depression, fostered connections, and many other health benefits. And
now therefore be it resolved, the Thurston County Board of Health hereby proclaims May 28th, 2025 as National Senior Health and Fitness Day in Thurston County and urge seniors to engage in regular activity to improve their everyday fitness and overall health. Adopted this 13th day of May 2025 by the Board of Health.
I feel like you're talking to me.
All right, go get our photo.
You'll recognize her when you see her.
All right, next on the agenda is to proclaim the month of May 2025 as National Walking Month. And I would like to have our good friend Lori Montoya.
I would like to announce Lori is now a doctor of nursing practice as of last. Give Lori her props where they are due, so.
Okay.
Thanks.
Dr. Montoya.
Yes, in all disclosure, I don't enjoy public speaking, so I have lots of notes here.
So I just.
We're just friends here.
Okay, so I am Lori Montoya. I am a registered nurse and also the program manager for the Parent-Child Health Program at Thurston County Public Health and acting as the interim program manager for population health. And as you know, May is National Walking Month, and so I'm just here, and for the sake of time, just going to briefly expand on the benefits of walking and then some of the things that we're doing in the population health team. So some of the things that walking helps to support is preventing chronic disease, reduces the risk of falls, boosts heart health, and improves mental wellness. And probably just as important, it brings people together. And so walking acts as a formal way of connecting with others. And these connections are important, as we've learned with seniors and with all adults, young adults, I think even young new parents, having those forms of connections are really important for their overall well-being. And as far as the population health program goes, we are supporting walking through a program called Safe Routes to School program. This is a small grant that was offered through Public Works, where we are supporting students with information and education on how to walk safely to school. So we're specifically working very closely with Pleasant Glade Elementary, which is has construction for a sidewalk project that's happening that hopefully will be done in the fall. So we're supporting kids walking to school. Yeah, so we do that. We do a lot of things with them. We share tips on, educating. We do little trivia things with them. We've coordinated with the Sheriff's Office. We've done outreach through Thurston County Fair and other outreach on education around safety for kids, and also supports, I think, the family engagement. So often parents come along with the kids and do these walks. We've also had cool partners, like we had a panther come and T-Rex come to kind of support some of the fun to walk. And one of the things coming in, so I am a military family coming into Thurston County. One of the things that I recognized pretty quickly was there's tons of trails and parks that I hadn't seen in other places that we have been. So I think that's important to note because there's a lot of really cool places that we can explore all over Thurston County. So, and actually my husband, really quick story, my husband transitioned out of the military and during that time he had a really hard time. He was, trying to figure out what he was gonna do. He was struggling with kind of that transition, had PTSD, and he has actually used Chehalis Trail to do biking and walking and running, and that's been his kind of saving grace, I think, in a lot of ways. So. Anyway, for community partners that are looking for nearby trails and parks and finding activities for young children, there's a really cool website. It's called www.projectnurturewa.com. They can go to and kind of click and find some cool places near them.
Project Nature.
Yes, Project Nature.
And then I was thinking as one thing we could do is I myself am going to go to a county park on, which is this last Saturday in the month, 31st. And I'm going to meet at 10 o'clock at the Deschutes Falls Park, which I've never been to in Yelm. And I kind of looked at what county parks we have. And so I invite
Pretty much our coolest one.
Yeah, it looks really amazing, and I've never been there, and I grew up here. So anyone who wants to join me, you are welcome. If we have too many of us, it will be an open meeting, and we need to pay attention to that. Also, there are 4 parks, so you could also split up and go to other parks if you want.
Cool.
Yeah, Fry Cove, or the
Burfoot
Kennedale, or Burfoot. So just would invite you to do that. If anyone wants to join me, love to see you. And anyone in the community, of course, I would be happy to talk to. So,
Yeah.
Great. Let's see, and let's read the proclamation to make it official. And are you okay if we start with you, Ty?
Sure. Thurston County Proclamation, National Walking Month. Whereas May is recognized nationwide as National Walking Month, as a time to encourage individuals of all ages and abilities, including seniors and those with disabilities, to engage in movement, enjoy the outdoors, and support their physical and mental well-being through accessible forms of physical activity such as walking or rolling. And
Whereas regular physical activity, such as walking, especially with others, is a proven way to prevent chronic disease, reduce the risk of falls, improve heart health, support mental wellness, and foster meaningful social connections that help combat loneliness and social isolation. And
whereas the U.S. Surgeon General and Thurston County have both recognized social isolation and loneliness as urgent public health issues, with 13.3% of Thurston County adults reporting they always or usually feel isolated, and 9.1% stating they rarely or never receive needed social and emotional support. And
here. Whereas walking strengthens not only individual health, but also the fabric of our communities, creating opportunities for neighbors to connect, reducing social barriers, and supporting more inclusive, age-friendly environments for all. And
Whereas Thurston County is committed to supporting the health and well-being of all residents by encouraging equitable access to safe walking routes, parks, and public spaces that promote both physical activity and social interaction. And
I'm the last paragraph guy today.
yeah, you're
Now
important.
therefore be it resolved, the Thurston County Board of Health hereby proclaims May as National Walking Month in Thurston County. We encourage all residents to take steps, literally and figuratively, toward better health by incorporating walking and movement into their daily routines, adopted this 13th day of May 2025 by the Board of Health.
Yeah, no photos.
Thank you.
All right. Thank you, Lori. Dr. Lori. So next, order of business is an opportunity for the public to address the board, and we do have our good friend, Mr. Trowbridge, signed up. So as you come up, feel free, if you're more comfortable sitting, you can stand at the mic, or if you want to sit, that's fine. And I'll just go over the kind of official part of the public comment. So Thurston County Board of Health welcomes comments from the public at all meetings. So following our guidelines for public testimony to ensure they are appropriate and do not take advantage of the televised nature of the meeting. All individuals testifying will provide their name and address. Testimony will be addressed to the Board of Health members, not to the audience, cameras, or staff. Cell phones will be silenced. No response is provided by the Board of Health following testimony. As needed, the Board of Health clerk will follow up with specific items. Speakers are limited to a total of 3 minutes, and the timer is displayed on the wall, which we can give you a heads up when we're getting down to the last 30. Speaking time may not be shared between individuals. Board of Health reserves the right to restrict an individual's opportunity to address the meeting for good cause. Lewd, offensive, inflammatory, hateful, defamatory, or discriminatory comments will not be allowed. All materials provided to the Board of Health may be considered public record and subject to public release upon request pursuant to the Public Records Act, Chapter 42.56 RCW. No outbursts of any kind, no comments that are commercial in nature, such as promotion of a for-profit business. All right, sorry for that lingo again.
We'll do the timer this way. So that you're open, okay? How much time do I have? You have 3 minutes, is that correct? Sure.
So I've been told by several of you people and associates that I talk too much. So I'm not going to do that today. I'm just going to give you guys a chance to read this one-page thing that I just handed out after I make a couple of announcements. One is you're going to get a copy of this in the mail if you haven't already. And those of you who don't already have it, a copy of the case that says Lake Shore residents own the bottom of the lake out to the bottom, 1945 case. I have loaned Dr. Harvey a copy of the Starry book, and she's promised to keep it for me for a month and pass it out to you guys if any of you want to read it, because I doubt you're really going to look it up online like I suggested you do last time. So go ahead, read the thing, and I'll shut up. thank you all for your attention.
Thank you. So public comment is now closed. The next order of business is an update on engrossed substitute House Bill 1946, clarifying tribal membership on local boards of health, and Dr. Freiheit will give us an update.
Yes, very quickly, thank you. The Thurston County Board of Health has gone through multiple reconfigurations over the past 4 years due to expansion of the Board of County Commissioners from 3 to 5 commissioners and other legislation expanding the membership of this Board of Health. As you are aware, the legislature passed another Board of Health related bill this year that directs counties like ours with 5 commissioners to have seats available for local tribal membership. How this is going to be implemented is currently being worked out by the State Board of Health and is expected to complete the rulemaking that could potentially go into the fall. PHSS staff will continue to stay engaged on this process. Also, we have reached out to our local tribal groups on this particular legislation, so we will keep you all informed as things move forward.
Okay, any questions? Commissioner Mejia?
Quickly, I'm sorry, yes. I was just going to provide a little bit of background, I guess. I provided this background at a board meeting for the county commissioners because I sit on the Association of Counties Legislative Steering Committee. And so this legislation started, there's only 2 counties with 5, well, they all have different Board of Health districts and Board of Health memberships, but the only 2 counties that have 5 county commissioners, which is kind of formed with a similar Board of Health to ours, is Spokane County. This is where the representative from Spokane decided to bring this forward and expand it, and it went through different iterations. At one point, it was whichever tribe had previously had, land in this area, so that basically opened up. Yakima, for example, would have to participate in a lot of Board of Health districts across. And so then it was reduced to the current tribal areas or tribal governments that were in each of the jurisdictions. And so for us, it would include just the 3. So just wanted to provide that a little bit of context. I had provided that when it first came out, and I learned about it at a Board of County Commissioners level, and I wasn't here at the last meeting, so I couldn't provide that update to all of you. So just wanted to provide that clarification now.
Do you have a question?
I just wanted clarification on the tribes that we had reached out to, and then I was it's not here. Nope, that's all. Just the tribes that we had reached out to that would end up holding seats.
Nisqually, Chehalis, and Squaxin.
Thank you.
Can I ask a question?
Yep.
So I can't remember if we've already addressed this in bylaws or is there a bylaw provision that says what a quorum is, like let's say the 2 new tribes, for example, don't want to seat someone, for example, can we still take a vote based on the number of people present at a meeting or the number of people that have been seated? I've gotten into this on many boards about how you define the quorum.
Those are good questions for the rulemaking process. But at this point, we believe it's that we are to invite the tribes.
Mm-hmm.
And it doesn't, if they decide not to come, that it doesn't impact the number of seats. But again, it's the rulemaking that we're waiting for. So you don't just have to add the seats. It's the invitation to the tribes.
No, okay, quorum question, whether or not actually added seats or not.
Sure. But within any number of seats, you still have that question of is a quorum the...
Do we know offhand what a quorum is for in our bylaws?
In our bylaws, we have it as just over 50%
of
the 12 current members. So we would adjust that based upon what comes out of the rulemaking.
So you effectively need 7 people.
regardless of who's there at a particular meeting.
Correct.
Not a majority of the quorum, it's a majority of the total number
I would
of
have to
seats.
look up the exact language.
Anyway, it's just something to
Of
think
the members
about.
present,
Get back to you.
Yeah, as we expand and, and then there's like, various levels of commitment I've seen in terms of tribes wanting to be involved or not. It's something to
Follow up on that question.
just to have to know.
In the bylaws, yeah.
Can I ask about the timeline then of like when, I know we're waiting for the rulemaking, are we going to wait for the rulemaking to come forward before the Board of Health makes a recommendation to the Board of County Commissioners?
I would recommend that we wait. I know we were looking at moving to the 10 members, but given the potential changes that are coming.
So we're just gonna kind of hold, okay.
Joshua, quickly, can you speak to, am I understanding that there's a potentiality that they don't accept and that everything sort of stays the same?
Correct.
Okay, thank you.
We don't know though, right?
Correct.
Yeah, so we don't know.
Of course, yeah. I just didn't realize it was an option for them to say no. Yeah.
Or nothing.
We don't know. It might not be.
Okay.
That's why Josh mentioned the rulemaking, but as soon as we have that information, we'll come back and report, and then to vice chair's comments, we can then track a process of engagement, conversation, and how that gets back to the Board of County Commissioners. That's right.
Any other questions? All right, the next order of business is on page 8. It is the Health Officer Director's Report. And if you have any questions, you can ask Dr. Breitheit. And I saw we have over 1,000 measles now.
And it continues on.
Continues on.
In the US,
In the US.
not in Thurston County.
Thank goodness, no.
The newspaper is listening.
Yes, not in
Be
Thurston
careful what
County.
you say, Karen.
A good clarifying point there.
That could have been an article.
Yeah.
Oh my gosh. All right, if there are no questions, then.
Oh, I'm so sorry. I do have
okay.
a question.
Yes.
And this is regarding the I-5 corridor, but you might obviously just know specifically for the county. If it does begin to spread more, do we feel like we have the ability to quickly assess whether or not we're ready regarding like medication availability within our county?
We're ready at any moment to ramp up, and we're already talking to the other counties as we have potential family members or close contacts from the airport or whatnot that have been in our counties. We're already following up with people.
And all the pediatricians have met and have extensive planning and screening and processes in order in the county.
Thank you. Would either of you be able to speak to, in a simple way, like what that assessment looks like? Is there like a group of you all, like a coalition of people that just sort of convene when these things happen, or?
Yeah, so we kind of did this during the pandemic. So the Washington chapter, American Academy of Pediatrics, family physicians, et cetera, we all have standard ways of meeting and convening.
Okay.
And we felt like this was crisis of enough. We've been having the experts talk to us and then working through protocols, both of like phone triaging, trying not to bring people in the building who might have measles, telemedding them before they come in, things like that, so that we protect people who might be in medical facilities as best we can. And then planning for if there is exposure, like, who do we call? How do we get the treatment for people who've been exposed and stuff who are vulnerable? And then we've all recalled like all the people who could have the vaccine who haven't had the vaccine. Like we've made sure that we're like, we'd love for you to get it. We'll get you in any time. And so, yeah.
Thank you.
Yeah, good question. All right, anything else I missed? It looks like everybody else has had enough time to read it. All right, and next on the agenda is a legislative update, and that's on page 11. And you can see the WSLFO end of session report in case there are any particular bills you wanted to have questions answered about.
WSLFO is the Washington State Association of Local Public Health Officials, and they keep very in touch with what's happening, all the state legislation. So they put out this very succinct, nice report that we thought, as we are adding a legislative update on our agenda, so we added this nice, succinct report.
Easy to read, very helpful. All right, any questions on that?
Sorry.
Yes.
I'm not seeing the point in time count bill on here. That one got left out. And that is, let me clarify this. So, right now, the state requires us to do yearly point in time counts, but the federal government only requires it every other year. And so the state, there was a proposition to align ourselves to the federal standards of every other year instead of every year. And so I just haven't seen it on here, and I was wondering.
I'll supply that in a response with other answers.
I have something to share. So the Board of Health authorized a letter earlier this year to the legislature regarding Apple Health expansion. And I saw the announcement this week that the state legislature did allocate $153 million for Apple Health expansion, which ensures that the approximately 12,000 immigrant community members who have that healthcare don't lose it. So that's a win. You know, it's more would always be better, but considering the, you know, financial constraints that the state is in now, I'm really pleased to see that was passed. So thank you to everyone on the Board of Health who supported the writing and sending of that letter.
Does it expand it at all or just maintain status quo levels?
I was trying to find that. I couldn't find that. I think that it's status quo, but I would have to figure it out. I just saw it.
It's just status quo.
Is it? Okay,
Yeah.
Perfect. Thank you.
It's too bad.
Yeah,
There's still more need, but
yeah,
better than losing it.
right. Yeah.
Okay, thank you for doing that. Right, next order of business is an annual review of the Board of Health strategic plan and the board's actions to date. And we'll love an input and update from Dr. Freihag.
Great, thank you. Before going into the subcommittees, I just wanted to give an update. We have been under our strategic plan for a year now, and we had written into the strategic plan that we would review it every year, annually, to see where we are in that. Given that we missed several meetings in the late fall, that we've been a little bit slower to go, which I do not say in a bad way. This is not a bad thing. I think that the things we've achieved in our subcommittees has been amazing for our very first year under this strategic plan. So my thought process was, instead of reviewing it this month or next month, is to bring it back then in the fall when we've had a few more meetings and a few more actionable things under our belt to then give an overarching review to our strategic plan. Some things have come up as far as is meeting monthly necessary for each subcommittee. Some of them are deciding no, that if we make sure we tighten up what our action plans or the objectives are for the year, that maybe we don't need to meet monthly on all of them. And so I think we'll revisit all of that when we look at the strategic plan in the early fall, if that's permissible.
Now, we'll just get our updates on our committees that have been meeting, or subcommittees. So first we'll do education and outreach. If there is anything you want to say, it sounds like we haven't had really a meeting since.
We have had a meeting, but we're just continuing on the same trajectory. There's no updates for us.
All right, and then Perla Newton, I think, has a little bit of an update on the data subcommittee.
Yeah, so we have a big update.
Right.
So yeah, this is the health disparity report that the Public Health and Social Services has put out. It's very informative, and it is focusing in on the factors that can affect health of our community in negative ways. And it's very important to get the information out there, not just for us, but for our stakeholders too. The information can be used to address these disparities. It is something that we really want to focus in on sharing with the community so that they're aware that the information is here. And from my understanding, we're going to have a report like this every year.
We'll annually update it.
Yeah, so it's going to be really good to see the trends and see if the numbers move
it's a very point in time.
Yeah.
Here's the data of the end of 2024, so.
And then there is gonna be a communication plan. So from my understanding, it's not live online yet.
Not yet, we are waiting for your approval.
Yeah, and after that, it's gonna be social media and press release and online access. And then we do want you guys to also go into the community and share this. We wanna know your questions so that you feel comfortable talking about this in the larger scale. And we wanna make sure that the information you relay is pretty consistent with what the information has here too. So that's another goal we have with this report.
It's our epidemiology team who developed the data points in this, and so sometimes that data can be dense. So that's part of the making sure that you're comfortable with we try to make it as plain language as possible for the community, but if you have any questions, this is the first iteration, the first year, so please bring those forward so we can update them annually and make it even more clear to the community. And we're hoping that it really can be a data point that can help inform policy, funding, legislation, that sort of thing. So,
I just want to say this is fantastic. And it's so timely. Me and Commissioner Menser attended the Thurston Forward, which was a DEI summit that happened this Saturday, and health equity was one of the items that was covered. And I got approached by members, and I'm also a member of the NAACP of Thurston County, and they were asking, like, when is this report going to come out? Because they want to build their data upon the data that we're building. So I'm very excited about this, and I think it's great to actually have it in this format as well. And I'm really excited to read through it. And so when is the timeline, when is the approval? And
I think today. Yeah, so I think this is the final form. And yeah, we're just gonna approve it if everyone is on that agreement.
okay, well then I would move for approval of the Journey to Health Equity, Health Disparities within Thurston County.
Second.
All right, all in favor?
Aye.
Any opposed? Yeah, it's fantastic.
It's going
Passes
online now.
put it
unanimously.
online, do the social media to advertise it, and
Oh, and did we have the talking points in the in here?
Yes,
Is
they
this,
are.
yeah,
For
okay.
the distribution communication
Yes.
plan,
Yeah.
there is talking points specifically.
Yeah, so in your packet, in the very back, we do have, yeah.
page 26, the last page.
Yeah, so yeah, the very last page of your packet. Those are all, that's basically the summary and the talking points, and if you get very familiar with this, it'll be a lot easier to introduce it. And the reason why we're introducing it to our stakeholders. This is awesome.
Very exciting.
Well, it's hard to follow that one.
Right. It is very exciting.
Yes, excellent. That's what I've been looking for like years. It's great.
How good is
All right, and then for policy subcommittee, was there anything you wanted to share?
We didn't have a meeting.
Okay.
Septic is coming.
Oh, great. All right, and then our next item on the agenda is open Board of Health discussion and information sharing. And one of the things I just wanted to ask to hear a little bit about was the South Sound Climate Action Convention. And I know Commissioner Munzer and I think Councilman Gilman are going to be there. I was invited, but I can't go. But I was wondering if you had any input on like what that's about or what.
Well, I've seen the schedule, which just came out, and this has been done in past years. Can't remember how long it's been since we've done it, but the schedule I saw, this is bigger and better than anything I've seen in the past. I mean, there's like 6 breakouts in 3 different, like, you know, stratums, and so they're expecting several hundred people registered, and so they're, you know, like as a breakout panelist, they're like expect about 50 people for your breakout. So, you know, if 300 people break into 6 breakouts, that's at least 50 per. So it's all happening at Evergreen State College. I'm on 3 different panels, so I'll be busy. But there's a lot of good stuff to see, and they have, I mean, like the panels I'm on are really good speakers. You know, I really shouldn't be there, is my feeling. There's one on new buildings, there's one on carbon sequestration, there's a solutions roundtable for buildings, existing and new buildings. So those are the 3 that I'm involved in, because I'm on the Building Code Council. And but they're covering all kinds of stuff. I don't know what Clark's doing.
Well,
are you on one of the panels, or?
I am on transportation infrastructure.
Perfect.
And I guess I would also say that I think there's value in coming together, because the each jurisdiction now has a climate staff person or staff people, and we have regional coordination, but there's been interest from the non-governmental organizations that we do more and we do more quickly. And this chance to have a day-long conversation, I think, about what is possible to accelerate in trying to reduce our environmental pollution and create more sustainable energy. So I look forward to the conversation and hope that it arms folks to ask for more.
Yeah, we're being told in our prep that, you know, focusing on what local constituents can do themselves to further the strategies is something we're supposed to make sure we focus on in ours, what we cover. So there should be, it shouldn't be overly scientific or overly, you know, it should be a good mix of technical stuff, but actionable items and what's happening in the community, and hopefully conversations about what could happen.
And it looked like there was quite a bit of, you know, health and equity piece in there, and the impacts of things we're seeing in our local environment. So
more data to bring to the conversation.
Put this in my
comment on that. So,
yeah.
I mean, I think this is great. I'm really excited for everyone. I know there's a million things going on this weekend and last weekend. There were multiple things going on. I attended Prairie Appreciation Days, and I just want to make this comment since we're in the Board of Health meeting that, you know, I actually had never been to Prairie Appreciation Days, had no idea what to expect. Convinced my son to come with me. I thought I was going to get there and there'd be like 5 people there in a tent, and pulled in, and I was like, right. I mean, you know, and overwhelming. So when we left, I was talking to my son, and I said, so what did you take from that? And we talked about this, and here's what I said. I said, there are so many people in Thurston County working on climate and prairies. There are hundreds and hundreds of people gathering together to talk about land and species and climate. But there are not these many people gathering together to talk about the people who inhabit it, and the health and the behavioral health and the mental health. You know, and I get so excited, like when I hear Clark say, there's a person at every jurisdiction that meets and, you know, for climate, you know, and I feel like it's our job to make sure that we have a person at every jurisdiction that's talking about health. And so, you know, I just want to put that out there because, you know, that was my take. I mean, I'm not saying I, of course, care about prairies, and I, of course, care about species, and I think that it's really amazing, and I'm really excited that there's going to be this big. I'm going to be building houses for Women Build this weekend, so I can't attend the climate action.
Just not on prairies.
Yeah, I won't be on prairie. But we did learn, so we actually walked the whole thing and learned, you know, these great things. But, you know, I just want to say that, you know, because I feel that we have a lot of work to do in Thurston County to be as loud and to be as coordinated and to be as organized and to have enough, people and events that celebrate and teach our community. And that's what this is about, right? That's what this equity is about. And so I hope that by next year, we're talking about how we're gonna have Evergreen covered in, 50 people sessions around what are we doing to create more walking paths together so people are connecting, and so that's my little soapbox, so.
Well, and one thought I had too when we had the discussion of all the senior supports and all these volunteers who don't get to do anything, I was like, maybe we should get some volunteers to support people who have a new baby.
Yeah, well, there's a million.
Because I bet those people would be pretty good with that too.
Yeah.
So, okay. Love it. All right, and then would you like to talk, Commissioner Mejia, about the potential for a youth representative?
Sure. As I was in my other seat as a commissioner, I was appointing someone for the planning commission, and this young lady applied, and I saw that she had gone in and provided public comment to the planning commission, and so I went and watched the video, and her public comment was about the health component on the comprehensive plan, and she was talking about vaping and smoking in middle school and high school, and she was incredibly passionate, and she was on point, and as I was going through it, I was like, that would be great, and those are the voices that we really also need at the Board of Health, right? I was like, it would be great to have a youth representative at the Board of Health level, because I think while we have some amazing experts in the fields, someone who's living it day by day has a different experience, and she was able to just relay her experience, and she did a wonderful presentation. And so I was like, I think it would be great to have a youth representative at the Board of Health. I spoke with Dr. Freiheit and Dr. Harvey about it and seeing if it was something, right, and kind of wanted to hear from the Board of Health on if that was an interest that you all had, and I think Dr. Freiheit can walk us through the process if there is interest.
Yeah, any comments or questions?
I think it's a fabulous idea to bring youth voice in around, especially around that topic, but others as well.
What Lynn said, and additionally, I am involved in a number of different projects in Thurston County where we have tri-led efforts going on between people with lived experience, youth, and system partners, and it sounds challenging, and what I have learned is I learn so much when I work alongside with youth leaders, so I could not support this more.
I agree. Yeah, I think it's an incredible idea. And I think that having a youth perspective represented at a table like this is really, really important. And I think they are a group of people that tend to be represented by what we think is best for them. So having someone here that's actually talking about experiencing that. The vaping issue, by the way, in middle schools and high schools is very serious. Like, very, 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 very serious. They're having to change around rules inside schools. Teachers have no ability to do anything about it, and it is extremely pervasive. So just regarding that. So yeah, I think this would be a fantastic idea, among other issues that they could talk about to help bring us information.
Well, I've only sat in on, Lacey has a youth council, and then they take those youth council members and assign them to one of them to all the other committees. So almost all their committees have a youth component. And so I've seen that in action over at City of Lacey and been very impressed by it. So I would like to try it here. I mean, here in this context or another context, I would really like to try that concept because it was impressive to see.
Another comment I had was I think it's really important to mentor that young leadership and support them in ways where they'll continue to lead the community forward. So I think it's fantastic. And of course, I'm 100%
Apparently on Commissioner Mejia's person that she's referring to, that person gave comment on two different topics at two different times and apparently equally are articulate.
Yeah.
The chair of the planning commission is, after you passed, he's lobbying me to appoint her as a replacement for him when he has to gravitate off. One of my planning commissioners is gonna be a port commissioner, but
She was really
but he is like I mean, he was leaning on me hard
Yeah.
and said this person should replace me.
It's cool.
So I'm gonna watch those videos.
Yeah, they're good.
What I would propose to do, because I've had experience in the past where a county or a body of government has a youth council, and yes, they delegate them on the various councils. So what we could do is we could take a stab at the bylaws, because this would be a unique independent youth application process and vetting and how we would choose that youth, and we can throw some ideas in the bylaws and then bring that to a future meeting to discuss if that's amenable to all of you and how we could move forward to hopefully before the fall or the end of the year, get a youth member on this Board of Health.
We have fair board members.
Don't we
right?
first have to figure out this new arrangement of the Board of Health?
A youth member typically does not take away from the current voting, the 12 votes. They get a vote, but it's more as a, what's the word I'm looking for? As a,
Advisory or-
yes, like an advisory seat. So they don't take away from the 12 votes in the seats that you have. So it's a ancillary sort of seat.
All
Let's
right,
take a look.
sounds like it's unanimous.
We'll look into it and we'll bring something back.
And then the next great idea that Commissioner Mejia brought up was the possibility of a extra, like a second vice chair for growth of leadership among our board. So I don't know if you wanna
Sometimes ideas pop in my head. Sometimes they're good
She
and
hasn't
sometimes
been
they're really
sleeping
bad.
well, no.
So one of the things I think when we went through elections was actually something that board member Cinceli Marshall said, and it was that mentorship opportunity, right? And kind of seeing as we're expanding or shrinking or expanding again on how to move forward and having community members join the Board of Health, knowing I think there's and as we're having more community members wanting to be in these leadership positions, which is incredible, I saw other models of organizations where they have a second vice chair position and an effort to kind of mentor and train up the next leader of who wants to step up into either a vice chair or a chair role. You know, we have some here locally. I think the Transportation Policy Board has that second vice chair position, and it's just, I think, just an ability for someone to kind of see, I guess, like the interactions and kind of learn. So that's why when they step up to either the chair or vice chair role, they know exactly kind of the way things run, the agenda setting piece, all of those things, kind of like a peek behind the curtain. Not really, there's nothing, there's no real curtain, but at least just kind of know more about kind of how things run and just more of a preparation. So I thought, you know, it's simply a recommendation, seeing if there's interest in that piece of a second vice chair position, and that was my thought process behind it.
Yeah, or other mentoring training ideas, like that was sort of the. Okay.
I think it's interesting. I really like this theme of trying to be intentional about providing resources and training for people who want to lead and who are interested in moving forward. So if there's a framework for it and if there's interest, then I think it would be beneficial.
And we did it on the Transportation Policy Board, and I thought it was helpful because it's a larger board like that, and there's community members. I think it's really good idea.
I guess, is this something that we would like for staff to explore and kind of bring up? Like, you know, I'm guessing it would be an election process.
Correct, and we would amend the bylaws to reflect that, so we could also research that.
Okay, so is this something, I guess, we have to provide direction, correct? Looking towards the table to see.
Do you think it requires a motion?
guess to have a motion so staff can go back and say that this was the direction of the Board of Health.
I move to direct staff to explore looking into amending the bylaws and adding a second vice chair to the Board of Health.
I second that motion.
All in favor?
Aye.
Any opposed?
Discussion.
Oh, any discussion? I'm pretty unanimous, sorry. I know, any discussion? I felt like we already had it, sorry.
No, it's not you.
All right, I think that was unanimous. I'm hearing unanimous.
Yeah.
All right.
Do some research and bring it back.
Thank you.
Chairmember Harvey, can I have two more quick announcements? One is that our Board of Health Clerk, Jacqueline Gilly, her last day with us was unfortunately Friday. So I want to give Jacqueline, who's not even here, but the very public props for all the work that she did. She was our policy program manager and Board of Health Clerk, and all the work she did for our department and for the Board of Health and in serving us during this past year. So if I could just give Jacqueline a round of applause. In the stead, Melanie, our executive assistant, is going to be sitting in and doing all the agendas and minutes and interim Board of Health clerking. One other announcement I'd like to make is in the audience is the new PHSS Assistant Director. Dr. Jody Becker is our new Assistant Director, so if you have not had a chance to meet her yet, this is Dr. Becker, and so just joined a week ago.
Maybe a couple of quick words.
Yes, if you are, I'm putting you on the spot. Have a seat if you'd like to give a few quick words about where you're from and how you came here.
Timer.
Okay, very good.
Good afternoon, everyone. It's a pleasure to meet all of you, and possibly we're still trying to figure out how we know one another. So my name is Jody Becker, and as you know, I'm the new Assistant Director. And I come to the county with extensive state service as well as federal service. I also have a deep passion for working in tribal communities. I've spent many, many years living and working in Indian country and working for a national organization. So I'm very happy and proud of the 3 tribes that are in our community. I come to the county from recently a federal position, and what really compelled me to come work for the county is to work on behalf of my neighbors and to really advocate and help those who need our help. And public health is new to me. I am a social worker by training and trade. My undergraduate, graduate, and PhD are all in social work. So I bring compassion, resiliency, and hope to this work, and really look forward to working with all of you, learning from all of you, and seeing what we can do together to continue to improve on the great services offered through PHSS and through the county.
Excellent.
And who do you represent? Where are you from?
I live outside of the beautiful community of Tenino, so I have been a South Thurston County resident since 2007. I hail from the great state of Minnesota. However, I've kind of matriculated westward in my adult years, but I live on a small farm. I'm a beekeeper and sometimes have chickens. Depends on the wildlife, but it just depends. Right now they've been eaten, so without chickens. But I love South Thurston County. I grew up in a rural community, so when I think about all of the rural communities across Thurston County, it's home to me.
Thanks, Jody.
You're welcome.
Yeah. Nice addition.
That's all, thank you.
Oh, you're welcome. All right, so now the board will meet in executive session to discuss the health officer recruitment update as allowed by RCW 42.30.1101G to evaluate the qualification of an applicant for public employment. And the board will be in We are calling our regular meeting back to order. It's 5:18. And we did talk about a second item during our session, which was responding to an email that we will be addressing some great ideas with structure of communication on the board and moving our amazing work forward. And the next agenda item is adjournment. May I have a motion to adjourn our May 13th, 2025 Board of Health meeting?
So moved.
Second? Further second? All in favor?
Aye.
All right. The May 13th, 2025 Board of Health meeting is adjourned.
Thank you.